lumbar muscle energy. We'll begin by demonstrating an FRSL. For an FRSL, we have the patient laying on their left side, as is indicated generally by the subscript in the FRSL positional diagnosis. So have the patient on the left side. First thing we want to do is to get them toward their barrier, extended. Strategy for doing that is to pull the lumbar spine toward the examiner so as to create a lordosis. From this position now we're going to block from above. If we're working on the L4, L5 segment to correct an alignment, we'll palpate the segment above and the 4-5 segment. We are then going to passively rotate the trunk, in this case to the right. Try to do it passively with no assistance from the patient. When the examiner feels movement in the superior finger in the L3, L4 space, the blocking is achieved. We then palpate the segment again, L4, 5, and we go one segment below. We are now going to block from below. To do this, we use the lower leg and take it into the extended position until we feel the sacrum nutate. Once we get into the active segment or the segment of interest, we back off so as to allow that to be free to be affected by our treatment. Now from this position, what we'll do is bring the right leg, the upper leg, into the segment. So we're going to use flexion to do that. I'm palpating the segment both below, at the segment, and above. Once I feel movement in the segment, I stop my flexion or sagittal plane movement. Now, from this position, what we want to do is to get the left side benders to activate. So we're going to palpate on the lower side of the spinous processes, palpating to monitor the paraspinals. What we want to do is to take our subject into side bending to the right, so we're going to raise the legs up passively till we're into the segment. So I feel the segment moving, I stay within the segment. Now what we're going to do, trying to get the patient to relax. If there isn't relaxation, just bend and extend, flex and extend the knee to get relaxation, and now we've got it. So I'm in the segment from a side bending standpoint. I'm going to lift the leg up, ask the patient for a contraction down toward the table. Relax, just a light amount. He'll meet my resistance. So I'm going to pull up gently. I feel hold that motion right there. Don't let me lift. That's hold there. I'm lifting up. Don't let me. That's perfect. I feel palpation. Through palpation, I feel a contraction of the left paraspinals. I hold 3 to 5 seconds. I relax. When I monitor the relaxation, it's an instantaneous relaxation. I then raise the leg a few degrees, staying within the segment, taking up the available side bending to the right. Thank you.